about us. Think about you leaving.
What's up, everybody? I believe we are live in all places. I'm trying to get this a little more working on Instagram there. All right, let's see where we're at. Hello, Instagram. What's up, Facebook, YouTube? All right, Ray, what's up? I see your question. Steve, what's going on? Roel, D-Lynn. Great to be with everybody tonight. I see we got a few people in here. Sally, Jay Rich. We're going to try to interact with Instagram as well tonight. As always, this is just a little bit of a different setup than what we've been doing, but I kind of like it. Believe I'm live over there. All right, you guys know the drill. If y'all got a question for Dr. Rogers, go ahead and put in the comments. We're going to get to as many as possible tonight. I'm going to put this up real quick. You guys know it is Men's Health Month. June is Men's Health Month, and we talked about the PSA controversy and prostate cancer today on the Common Sense MD. If you guys have not checked out this episode, watch it. We get a ton of questions around the PSA and what Dr. Rogers thinks about it. Should I get it? Should I not get it? And obviously it's been in the news recently. So check out that episode to get Doc's full thoughts on that. Maya, what's going on? Hello. And we're running specials all week, I believe. There we go. In all the offices, JC and Knox, we got the Tri-Cities. These are some aesthetic specials, as well as testosterone shots and Vitatrim shots in all 5 offices, all 5 locations. And then aesthetics in the 2 aesthetic offices in JC and West Knoxville. You can see Kingsport there also is doing his waves for $1,000. I'll be putting these up throughout the evening. I want you guys to know that we're running these specials all week. If you have any questions, put them in the comments. We'll be answering them all night. Let's see. Tom, my brother, what's going on? Hit 400 today. I love that. I love that. Thank you, Roel. Jerry, I see you. I see you, Steve. No discounts yet, Roel. We're still working on that. Expect those in the next couple of weeks. So stay tuned for that, Roel. Let's see. Let me catch up here real quick. I want to put this up for everyone. One, because this was a really fun episode. The latest episode of Explain This with the star of the show, Robin Riddle, is on off-label uses of migraine medications. Specifically, she's talking about slowing down the progression of endometriosis and pain associated with that. So it kind of goes along with endometriosis, but it's super interesting. Nurtec, if you guys have heard of it, is a migraine medication that she kind of focuses on in this episode. So super cool. Thank you. Huge shout out to Robin for doing that episode. I love, talking about off-label uses of certain medications that you guys might not think of. 865 PT, what's going on, man? It's great to see you. Great to see you. We need to link up. All right, let's keep moving. Aloha, Grandma Mary. I had such a blast with you guys. Shout out to the Blake. Man, that was so much fun this past weekend. I had a luau over there at the Blake. Ivy and JC with Ivy, what's up? That's right. We got Taco Tuesday. We're going to let a few more people come in tonight, and then we're going to get to some questions. All right, ready to roll? Let's rock. Doc is on his way. Let's see here. I'm going to press.
Hey, Ben.
What's going on, man?
It's good to be together here.
I tell you what, it's so much fun doing this live, like in person. I'm way more relaxed this way.
How do you know I'm not a robot?
What do you think about AI in healthcare? I was listening about that today.
I use it for some of the research stuff I do too.
But what do you think is going to happen? Like, do you think?
I think it'll be useful.
I do
really
too.
Yeah, I do.
I think it's going to be a really big deal, and I think that, I think it's going to add to people's health span.
I think it will too. I think you could get carried away with it.
Sure.
You still need some human judgment, but AI comes from human judgment.
Yep.
So I think it'll be great. I use it a lot already for study. Putting together studies. I have that paid app that I use, Contour. It's for medical
You using that quite a bit?
doctors. Yeah, I do. When
Yeah.
I'm looking up something that's kind of controversial, it'll summarize all the different studies, and so I do use that a lot. It's a great little app.
Speaking of controversies, you talked about a controversial subject this week.
Oh, PSAs.
PSAs.
Yeah, prostate cancer.
If you guys have a question for around the PSA, around prostate cancer, put in the comments. It's timely. It's Men's Health Month, and yes, we're running specials. As I see Carter's in here. Carter, what's up?
Hey, Carter.
It was great to see you today.
Thank you for help on the computer today.
There we go. I'm gonna put this up. Carter's eating a Brookhaven, New York strip. As you can see, I'm
Those are good.
supporting
Those
Brookhaven
are
Farms. That is the best steak, Carter. I love that. That's so cool. Let's see, who else am I missing? Okay. I see Steve's question around the Ozempic. Okay, cool. So do you think the PSA is controversial?
Yeah, sure is. Yeah.
And rightfully so?
Well, probably because it's not a perfect test, and you have to interpret it in light of velocity, sometimes density, free PSA percentage. So a lot of people freak out when their number's a little bit high when they don't need to freak out. So you have to know how to look at it, know how to follow it, know how to know when you need further testing before you get biopsy. And nowadays we have better tools to do it.
Yeah.
So I've seen a lot of PSAs, and I have a lot of experience with prostate matters, and so it's getting better now. We have MRIs and for prostates, and we've been sending people to Chattanooga and Atlanta for years and years and years.
Yep.
And now we have MRI in this area, and we have ways of looking at it. Fortunately, prostate cancer is very slow growing cancer. That's why it took them 12 years to find Joe Biden's prostate cancer, which is kind of a lead into my podcast. How in the world could they miss metastatic prostate cancer on the president of the United States? Who knows what was going on?
Yeah.
Maybe they knew, maybe they didn't.
Yeah.
I mean, if you look at the recommendations from the U.S. Preventative Task Force, I mean, they don't recommend after age 70 you even get a PSA, because they think, well, you're not going to have a 10-year life expectancy anyway, but there's a lot of healthy 70-year-old guys around there. So I think you need to keep checking them. It's not a perfect test, but certainly you just don't give up on somebody when they're 70.
I agree.
I mean, Biden hadn't had a PSA in 10 years.
Yeah.
And boom, he has metastatic prostate cancer. That's been going on for a long time. So that's a potentially very painful death. He's going to have to get major treatments and all this stuff. So, if they caught it early, it could have been, dealt with a lot easier. But so there's a lot of controversy about prostate cancer, about PSAs and how to test for it. And most doctors don't know unless you do a lot of it. Most doctors haven't checked many prostates themselves.
Yeah.
So it's controversial, but listen to the podcast. I think it's a good podcast.
Yeah.
For those men out there, it is Men's Health Month, and that's one of the things they worry about. And they have to deal with prostates as you get older.
Yeah.
They enlarge, and your PSA goes up, and sometimes it's worrisome.
Yeah.
But most of the time, it's not.
Well, that's one thing you said in the podcast is, most men are going to die with prostate cancer, not of prostate cancer.
Right.
And I think what you're talking about there is that you stay on top of it. There's things you can do.
Yeah, nowadays it's much more reasonable. You can used to be if your PSA was over 4, they just biopsy you immediately, which carries its own. It's very painful. You get infected. It's a harsh deal. And also, they took too many prostates out, for low grade cancers that didn't have to do anything with.
Yep.
So there's a lot of nuances, a lot of different opinions, but let's listen to the podcast. I think it's a pretty good podcast.
Yeah, I think that was a really timely episode. So I hope you guys get a lot out of that. Share it with the men in your life, and we're gonna answer any questions around that tonight. So if y'all have any questions around anything regarding men's health or you guys know, health and wellness in general, we're gonna answer everything tonight. All right, let's go ahead and get to the questions here. One came in throughout the week. Thank you guys in advance for that. This one came in today or yesterday. I had some blood work done last week for an upcoming endoscopy. My sodium level was low at 132. My potassium was good at 3.9. My chloride was 98, which is almost low. They told me to start drinking electrolytes. I purchased some liquid IV packets and have been drinking one daily. How will I know when my levels are good and can stop drinking one every day? And then we'll note here is drink a lot of water, but seem to just be peeing it out. This is a great question around electrolytes. And my question would be like, should you stop doing the...
No, not if you're active, you sweat a lot. But the reason your sodium is low and your chloride's low is because you drink a lot of water. You're kind of diluting it out. And I've seen people drink so much water that their sodium got down to 108 and they went into a coma and had seizures because of it. So you can drink too much water. The problem is we've demonized salt through the years, and actually salt is good for you. I mean, 80% of people don't get enough salt. And really, to be honest with you, it doesn't raise your blood pressure. There's a few people that may affect it a point or two, but salt is something you need.
Yeah.
Like sun's something you need. Salt's another one of those things that's been demonized. Get on a low sodium diet, low cholesterol diet, stay out of the sun. I mean, it's all terrible advice. So eat more salt and electrolytes. If you just put more salt on your food, you probably won't need to drink those electrolytes. The only way you're going to know if it's normal is to get another level checked. But at 132, it's not a freak out level at all. If you're cramping a lot, that's usually low sodium, not low potassium. I was a team football doctor for 35 years, and we had guys cramping in August and early September every year because they didn't need enough salt. And they hydrated, but it was just pure water. So they need to drink electrolytes and salt everything. So salt's been demonized, and it shouldn't be. So, but you'll be fine. You'll be fine. Just start salting things.
And there's one thing. My buddy was playing tennis, and he was super hot, and he drank a ton of water, and it dropped his electrolytes way down low. And then he went to the hospital, and they messed up the bags of just hydration.
So it wasn't sodium.
It didn't have any electrolytes, and they almost it was like pretty scary at the moment.
80% of people that are admitted to the hospital for any reason are usually sodium deficient, and they give them immediately. They talk about how bad salt is. The first thing they do with you is put you on a sodium chloride drip.
Yeah.
They start it every time.
Yeah.
So it's really kind of bogus. There are certain exceptions of that, but for the most part, eat more salt.
All right, guys, we're going to get to the live questions. Thank you for that question that came in over email. I see Diane's question. I see Edna's in here. Edna, I hope you're doing wonderfully. Thank you so much for being in here as always. Let's get to Ray's question, which is around the podcast. If I got that up, there we go. Before treating prostate cancer with proton therapy, is it typical for the urologist to ask the patient to do hormone therapy to lower testosterone levels to 0? That seems extreme to me. And let me know, Ray, if there's any context to that. What's your thoughts on this, Doc?
That seems just dumb to me. Heck no, I wouldn't do it. Number one, testosterone does not cause prostate cancer, and it doesn't feed the fire. That's BS. Read the book Testosterone for Life by Dr. Abraham Morgentaler. at Harvard. He's the chief urologist at Harvard and the expert on testosterone and prostate health. Read that book and you'll get yourself on some testosterone if you're not. But no, you don't want to lower your testosterone level to zero. Sometimes they do that with metastatic prostate cancer. When things are really extreme, they'll give you these drugs that are what we call castration drugs. If you read Dr. Morgenthaler's book, you'll find out why they did that, and it helped one patient back in the 1940s, which led everybody to believe that testosterone caused prostate cancer. It doesn't do it. So no, I certainly wouldn't do that at all. Just for medical legal reasons, I probably wouldn't until you got finished treating your prostate cancer. I wouldn't continue your testosterone shots if you're on them, or creams or whatever. But no, I mean, I can't see that unless you already have metastatic prostate cancer. If you had that, they wouldn't be giving you radiation, I don't think, or taking your prostate out. It's going to be really interesting to see how they treat Joe Biden. There's some newer treatments that are chemotherapeutic, and certainly a lot of people use Casodex and some things that will just wipe your testosterone out, but it's usually not a good idea, in my opinion. It's interesting. It's not real typical to me that they would tell you that. Usually if they do put you on hormone ablation, it's after they decide what to do and if it's metastatic. But again, there's a lot of misunderstanding about it. In your case, may be different than typical. So it's hard for me to give you advice, without you being my patient and us having a discussion, looking at the grade of prostate cancer, your Gleason score, and looking at all the scans to see if you have any spread outside the capsule, in the lymph nodes, etc. So there's a lot of nuances, not only to detecting prostate cancer with PSAs, MRIs, etc., but there's a lot of different ways you can treat it. Certainly, if you decide to go the radiation route, the proton therapy is a little bit better than the old external beam or even the seed implants, which my dad had for his prostate cancer, and he wished he hadn't have done it because it really really hurt bowel function, things like that. Radiation burns a lot. I don't care if it's proton or what. Proton's better, but it's still going to burn, and it's a thing that you're going to have to do daily for a while. They're getting better with it, but I don't know why they would give you hormone depleting therapy, before your proton therapy. I don't know. That doesn't make sense to me. But again, I'm not your doctor, and they may know something I don't. So just ask them. Ask them, why are you doing this? Get a good explanation. Just don't take things verbatim from any doctor. And if you doubt it, don't do it and get a second opinion about that. So,
Ray, thank you so much for that question. Super timely around Men's Health Month. And hopefully that helps. Let me know in the comments if there's anything we need to, if we need to clarify anything. Okay, let's go to Steve over there on YouTube as well. How can I start losing weight because my shots have quit working? It seems Steve is on Ozempic, if I'm reading that right, Steve. Okay, so how can I start losing weight because my shots have quit working? Seems they've maybe hit a plateau if they're on Ozempic. And if I'm messing that up, Steve, let me know.
Yeah, I see that quite often. Number one, you still have to learn how to eat and exercise. There's no doubt about it that has a lot to do with it. But for people with metabolic syndrome and that are fairly obese, it's very hard, if not impossible, to do it on your own. You need some help. And that's why these GLP-1s have worked so well. But I will tell you that it's a maintenance drug. And sometimes you can plateau, you get a little tolerant. If hopefully you've worked your dose up to the maximum dose, because that's how it's supposed to be. And then you stay on it, because if you get off of it, you're going to gain the weight back 94% of the time. And then that's only after major changes in dietary function. And look at all your other parameters too. I mean, there may be another reason. You may have a thyroid problem. You may have a low vitamin D. You may have a cortisol problem. You may have a testosterone problem, too much estrogen, not enough testosterone. And getting back to the other question, what they should be doing is looking at your estrogen level with that prostate cancer. That's something they never even think about. But that estrogen is not good for a man's prostate. Testosterone is actually good for it. Estrogen's not. But in any event, so I don't know what dose you're on. I don't know if you have worked your way down. The other thing, besides looking at the other metabolic parameters and diet and exercise, is sometimes I'll switch people when they plateau on Ozempic to Mounjaro or Zepbound, which is actually a better drug anyway. It works better with less side effects. So sometimes I'll switch you over to the other GLP-1, which has a GIP in it as well. So you need to look at all those things and kind of see where you're at. You have to look at sleep patterns. I mean, there's so many factors into this. That's why dealing with weight loss patients is complex. It's not what goes in comes out. It's just complex.
Yeah.
You need to look at your insulin numbers, and there's some other stuff you can do as well that we do besides shots.
Yeah. The other thing is also our nutrition coach Lucas talks a lot about just lifting weights and making sure you're getting enough protein in as well, and that can actually help you lose weight while on the shots.
Yeah, it's not about losing weight. It's about gaining muscle and losing fat.
Yeah.
You should get an in-body evaluation by Lucas and see where you're at.
Steve, thank you so much for that question. We're going to keep going here. Oh, this is awesome. Jay had a great visit the other day.
Oh,
Doc.
J34.
That's
he told
right.
me exactly. He came in. I came in and said, "I'm J34. This is my lovely wife."
I love it. Jay, thank you so much for coming in, man. Thank you for being here.
Jay, I thought that was your daughter you brought in, not
That's
your
right.
wife. I was shocked, but I'm kidding, Jay.
I love it. Jay, thanks for being here. Tell your wife thank you for coming in. I hope she's watching as well. Okay, let's keep going. Let's get to Oliver here. Are routine breast cancer screening recommended for a woman after 50?
Yes, for sure. That's the woman you want to screen. In my opinion, and again, there's just like I talked about the PSA and when to start screening for it. I think you should start screening for breast cancer at age 40 on everybody, sooner if you have a strong family history of it, and certainly if you feel any nodules or anything. But, today with the low dose 3D mammograms, they're good. And now we have MRI, which insurance is hard to get to pay for it. We have diagnostic ultrasound. We have thermography if you're just totally paranoid about getting a mammogram. But yes, I think yearly you should get them. Now you're going to read all kinds of stuff like it's not going to matter in the end. It's not going to kill you. But I can tell you from experience, I've seen a lot of life saved by mammography. I just have.
Yeah.
As well as the other modes too. So I do think it makes a difference.
One thing I do know, just kind of working with you here, is you're huge on screening, and if you stay on top of your screenings, it allows you to prevent a lot of scenarios.
I'm huge on prevention and screening.
Yeah.
And things start to happen after age 50, like hormonal deprivation, things like that. That's when you're most likely to have any kind of cancers after menopause.
Oliver, let me know if we need any more context. Hopefully that helps a little bit. We're going to keep going here. All right, let's see where we at. Let's get to Jerry. What's the best nicotine patches to get, or is the gum better? Also, can I buy in the UK that you recommend? Well, Jerry, are you in the UK? That's awesome. I love the UK.
Oh, yeah. We have somebody from the UK and somebody from Australia.
That's right. I think.
Are we getting world famous?
No.
I don't think we are either.
But this is a great question because I have a lot of my friends who are I don't think they would mind me telling you they're addicted to these Zen patches or Zen things. They're
Put them in your
they're Zens. They put them in your lip,
yeah.
and it's nicotine,
Yeah.
but it's addictive.
Oh, for sure. Nicotine is not a bad product. As a matter of fact, it's the only good thing in a cigarette. So it can be a good thing, but it can be very addicting too, because it clears your brain up a little bit. We use it for a ton of stuff. The best nicotine patches is just one that's generic. I forget the name of the brand name, but now they're all generic. And I do like the patches or over the gum. And if you get the gum, don't chew it up. Just stick it in between your cheek and gum, kind of like you would snuff or something. But I just think it can be irritative to the mouth. I don't like that kind of thing in there for very long. So I like the patches. I put somebody on it today for what I think is long COVID. We learned to use nicotine during COVID for the brain fog. A lot of times your taste and smell would come back pretty quickly. It's great for your brain, dementia. It's just, there's a lot of positives with nicotine. It gets a bad rap because of the association with cigarettes, which are terrible. But yeah, just go get a generic nicotine patch. Just slap them on your side and leg, twice a week, and see if that doesn't help you.
I'm glad you said twice a week because I've had my friends kind of ask, where is kind of crossing the line? Twice a week, nicotine patches. Jerry, I hope that helps. Thank you for being with us over there in the UK. I love that. All right, I saw another one on Facebook, if I can find it. Let's see. There we go. Diane's asking, can a parasite cleanse help with prostate cancer? Great question.
Yeah, I think it can.
Yeah.
I mean, anybody that has any type of cancer, I think could benefit by a parasite cleanse. And then staying on some Fenbin and ivermectin. We use them all the time for almost every kind of cancer you can imagine. And, it's not going to hurt you.
Yeah.
So I'm all for it.
Yeah, we've done a couple podcast episodes on parasite cleanses, and I got the same feeling on all of them. Like, one, they kind of scare me because I don't know if I want to go through
what Andy did. Yeah.
But also it's like
seeing larvae.
But it's also like, man, everybody. It kind of feels like it would help everybody. Thank you so much for that question, Diane. I love this from Tom. This is around the question with the sodium drips in the hospitals. Standard just to keep veins open with the sodium chloride?
Well, that and to hydrate, because most people are dehydrated when they're sick. So, and plus access, for emergencies, if they need to use IV antibiotics or anything IV. So yeah, that is one major reason for starting a sodium drip on people, and they get better. If you've ever felt awful and you go in and get a sodium chloride solution in your veins, you're immediately going to feel better.
Tom, thank you for this comment, man. I love this from Jeff here. Jeff, thank you so much for being here. This is amazing. I've been using methylene blue and love it for clarity and focus. Totally agree. I take mine every day. I also take it for my immune system.
Thanks, Jeff. Yeah, I'm glad you like it. It's just a great product. I use it daily, and it's great for energy. It's great for breathing, and it's safe. Go to the podcast we did on methylene blue. We've done at least one on there. And, thank you for saying that, Jeff.
Yeah, thank you, Jeff. Let's get this to Amanda here. Thank you, Amanda, for being here. Is it safe to sedate a 4-year-old for lip tie? Putting my child under scares me. I totally get that. That would scare me too. What's your thoughts on this?
Yeah, I think it's a very safe thing. It's mild. It's very mild sedative. As a matter of fact, Andy, we had to do that when he was younger than that.
Yeah.
I mean, he had to have that procedure done. It wasn't just a frenulum that was tight. The whole bottom of his mouth was tight.
Yeah.
So, So they did that same thing, a very safe procedure. It works very well. It prevents a lot of speech problems later on. I wonder what Amanda would say about that.
Yeah, I'd be interested.
Ben's
as well.
wife is a speech pathologist.
Yeah, that'd be super interesting. I'm sure she sees that all the time, probably for the therapy afterwards to work on the speech. So Amanda, thank you so much for this comment. Seems like this is totally standard.
Yeah, I wouldn't hesitate at all. But you think that's why Andy talks so much now, because he had that procedure done?
Maybe. He's
a little loose-lipped. You know? He really is.
Shout out to my brother.
I hope he's not listening.
I know. Let's get to Danny here. Danny, thank you for being. I see Steve's in the building. Steve, nice. I love you, brother. Thank you for being here tonight. For someone that's 95% carnivore diet on a lipid panel, total cholesterol is 244, LDL 176, HDL 60, triglycerides 36. Would you recommend a statin? Great question.
That just depends on the other risk factors. I'm not one that slams everybody on a statin like most doctors. Probably 98% of doctors would put you on a statin, no matter what your other risk factors are. Now, first of all, I love a carnivore diet. I had a guy today who was going over his Cleveland with me, and he, at the time he got the Cleveland, he was on a vegetarian diet, and his cholesterol was lower than before, but his inflammatory markers were higher, and his insulin resistance was way greater. So he switched to a carnivore diet about a month ago, and he's already lost 10 pounds in a month, and all his joints are not hurting. So he likes it, even though his cholesterol is probably going to go up just a little bit. But those triglycerides are great. Your HDL is good. I just don't put everybody on a statin. And I like a carnivore diet. Number one, I don't think cholesterol causes heart attacks in the first place. It's more insulin resistance, inflammation, that kind of thing. So you always have to weigh the risk versus the benefits of a statin. And there's a lot of side effects to statins. So number one, get something like a Cleveland, where we can look at the particle size and your ApoB, your LP(a), and do a little deeper dive into your lipid panel, look at your fatty acid profile. Get a CT calcium, see if you've got any calcium deposits in your coronaries. So you have to look at the whole picture. You just can't look at one number. You're like, wow, my LDL is 176. I got to get that down. It would get it down, but look at the other risk factors. If you don't have any, I wouldn't put you on a statin personally. I just don't have to put a lot of people on statins anymore. Yeah. I have some, but I'd have to look further at your case.
Danny, I hope that helps, man. Such a great question, though. Anything around stuff like that is just helps so many people. So thank you so much. And congrats on the carnivore diet. That's super interesting about the Cleveland before and after a carnivore.
Yeah.
I haven't thought about like that sort of transition. That makes so much sense.
Yeah.
Real quick for D-Len. D-Len, thank you for being with us as always. What milligram nicotine?
I think 2, starting at 2.
2.
Yeah, you can go up to 4 if you need.
All right, D-Len, hope that helps. Let's get to my brother, Mark. Mark, thanks for being here as always. Could SARS-CoV-2 infect prostate cells by using ACE2 and TMPRSS2, and in doing so, trigger inflammation or other changes that might increase a man's risk of developing prostate cancer? Let's see if this goes to this one. Glutamine plays a critical role in the development and progression of prostate cancer. Thoughts on targeting glutamine metabolism as a therapeutic strategy for cancer?
That's a lot of people have posed that theory. Definitely put it back to the first part of this question on the ACE2 inhibitor or receptor. That's how the SARS-CoV-2 got into the cells. I don't know about the other TMPR. I don't know about that one at all. But most people know it got in by the ACE2 receptor, and certainly can trigger inflammation. And inflammation causes cancer. So, and there's no doubt we're seeing a lot of these turbo cancers now that we're going to talk about in a podcast very soon. I'm going to do a podcast this week with an oncologist. So I'm going to ask a lot of questions. I know she's seeing a lot of these turbo cancers, two at once, that she'd never seen before in her, 20 some year career. So, whether it's not the actual COVID virus or the vaccine itself. But yeah, there's no doubt that I think it does set off a lot of these things, as well as some autoimmune things that we see. Now, whether or not glutamine is going to play a big role in that, they're doing research on it right now. And a lot of people think yes. And it could be that, we target the glutamine, possibly. But stay tuned on that one. Mark, I'm telling you, he should be in a lab somewhere.
Yeah.
You need to be at MIT in a lab, Mark.
Mark, thank you so much for that question, man. Great, thoughtful question. Super, super interesting and timely as well. Thank you for being here as always. Real quick, I see a comment here. I scrolled past it. Tom, you've been with us for a year, man. That is incredible. Tom kind of has been with us in this community for a year. I freaking love that. Who else has been with us for over a year? Has anybody been in on these Q&As, these live sessions with us for over a year? I want to see it in the comments. I love that.
How long
Tom.
have you been doing this anyway?
Years.
How many years would you say?
If I had to guess, I'd say pre-COVID, I'd say 6, 7.
Wow.
Yeah, we've been doing the doctor's note for 8, which has been the guys. If you haven't signed up for the Performance Weekly, that's where we send the doctor's note. That's where all this stuff comes from. Sign up for it. Comes out every Tuesday. We've been doing that for 8 years.
Yeah, I know we've been doing that for 8 years. I forgot when we started the Q&A.
I
like this community. People
this
are smart
is fun.
out here.
This is fun. I love this. I love seeing these thoughtful questions. And like I always say, we learn as much from you guys as you learn from him. So thank you, guys. Sure. Let's get to Connie here. Connie, thanks for being with us. Would inflammation marks on your Cleveland also indicate arthritis?
Yeah. Inflammation markers, probably. Yeah. A lot of times, they're geared towards inflammation of your arteries, but certainly I see a lot of people with arthritis that their CRP is out of the roof, and I'm pretty sure it's from the arthritis. So yeah, the other thing you can do is a SID rate is another one that we look at for arthritis. It's more specific, and then we go along the autoimmune trail where we can get ANAs and Sjogren's panels and all that. But yeah, they certainly can. Now, things like your myeloperoxidase and your oxidized LDL numbers, would probably not be affected by that, but certainly your CRP could.
Yeah. Connie, great
I see
question.
that all the time.
Great question. Thank you so much for that. I want to put this up real quick. One, Tom, you're my people, man. Thank you for being here. We've got since the beginning. Kara's been with us since the beginning. Shelly on and off for a couple years. Few years actually with D. Len. Roel, 5 years and going.
Man, we've been doing this a long time.
Has not missed an episode, I don't believe. Roel hasn't missed one. I love this from Mark. Goes back to Live at 5. This is
Live at 5. That's what we first called it.
It was first Live at 5 because we didn't get any questions at the beginning. We had to come up with a
great picture of Mark reading the newspaper.
I love it.
He's always reading, he's always researching something.
I love that. Thank you, Mark. Let's put this up from McLeod. I love you guys in Jonesboro, McLeod Organics. This is Jennifer.
Hey, Jennifer.
Been on the live Q&A for more than a year. We learned so much ourselves. Thank you so much.
Thank you.
Thank you
That's
so much.
That's a great shop.
Yeah, we
love that. I love it there.
That's
I
amazing.
haven't been to Jonesboro.
I know
several months.
I need to go there. They just opened up a new coffee shop.
They did?
Yeah, in downtown Jonesboro. Am I wrong, Jennifer?
I love a good coffee shop. Jonesboro is such a beautiful town.
It's beautiful.
It's the ultimate American town.
Yeah.
Go there on July 4th. You'll see what I mean. I've been there many times.
On July 4th?
Yeah, I mean, it's incredible.
That's cool.
The get-togethers and music, and then the fireworks. It's phenomenal. That's Americana.
There we go.
It's Jonesboro, and then you have the the storytelling, the Jonesboro players. Just amazing place.
Allison, thank you for being back with us.
Hey, Allison, I hope you're feeling great.
We missed you. We missed you so much.
You're doing great.
Yes.
Finally back. We looked for you at the luau, but
yeah,
either you were up dancing with the Hawaiian ladies, or you were not there.
I love it. She's got a question for us. Have you heard of stomach migraines?
Yeah, some people call them that when you have your stomach irritability will trigger a migraine. Yeah, that's the old timey word for them. And like I always say, you can't know somebody's stomach unless you know their head. So there's a big gut brain connection connected by the vagal nerve. So they go hand in hand. And some of these new medicines we use for migraines help your gut as well, like Nurtec, Ubrelvy. But sometimes knowing the triggers help.
Yeah.
Dr. Fitzpatrick is doing a great job with acupuncture on these migraine patients.
Yes.
I need to do another podcast with him.
Yes, that was super, super interesting to hear. The first one you did with him was absolutely phenomenal. Yeah. So that's super cool. Thank you, Allison, for that question.
Migraines can take many forms that you can almost feel like you're having a stroke with a migraine. You can't move your arm.
Yep.
Or you lose your vision.
Yep.
Migraines can be scary.
Allison, thank you so much for that question, and thank you for being with us tonight. I want to go over here. I see Whitney's over there. Whitney, I hope say hello to your husband again. I loved your husband. He came up to me a few weeks ago in Kingsport. Let's get to Big Papa of 7 on Instagram. I'm just going to read it for you guys. I have lost 75 plus pounds since August of last year. I have stalled and need to lose another 100 pounds. I've read several GLP-1s have some long-term. Am I missing something, Big Papa? Long-term, and then it says, what would you suggest? I'm assuming long-term side effects. What would you suggest to get things started again? And I need to lose another 100 pounds. What's your thoughts here for Big Papa?
Well, like I said before, a lot of it, you need to look at all the other factors along with not just taking a GLP-1. Certainly, like if you stall out, it sounds like you definitely have some insulin resistance metabolic syndrome. So I like the GLP-1
GI side effect. So long-term GI.
Oh, long-term GI. Yeah. I mean, you could have, but you always have to balance the risk versus the benefits. If you're having some terrible GI issues with it, you may not be able to tolerate it. Now, some people that can't tolerate Ozempic can tolerate Mounjaro or Zepbound. It's way easier on your stomach because of the GIP. It's a strong GIP, a weak GLP-1, whereas Ozempic or Wegovy is just strong GLP-1s. So it depends on what kind of problems you're having. I mean, definitely chronic constipation can be a problem with any of them. And it seems like if you're on the semaglutide, I would try the tirzepatide. I would switch and continue because, again, these are maintenance medications. They're not just lose 50 pounds and stop it. But you have to look at all the other stuff, including what you're eating, how you're moving, what all your hormone levels look like, and optimize your thyroid, look at your cortisol, look at your sleep patterns, look at your testosterone levels, your estradiol levels. There's a lot of different ways you can do it, but I absolutely believe you can do it. It's going to be a lot easier. And again, the long-term overall side effects of these medicines are less heart attacks, less strokes, less dementia, reversal of non-alcoholic fatty liver, reversal of chronic renal disease. I mean, all these specialists are using these.
Yeah.
Now, they do delay gastric emptying. So sometimes, medicines, you got to look at medications you're taking. Like if you're taking the birth control pill, you got to be careful because you're not going to be absorbing it as much through your small intestine. You're more likely to get pregnant. I've seen that. So you have to think about that. And if you have any pancreas problems, you don't want to take either one of them. But chronic constipation is certainly an issue. especially if you have severe reflux or a really large hiatal hernia. So there's a lot of factors to be taken into account, but you have to weigh the risk versus the long-term benefits as well.
Yeah.
So a lot of times there's ways around the gut problems.
And I see here, Big Papa is he's carnivore / keto, which is awesome. Never taken GLP-1s.
Oh,
Gotcha.
I thought he was on GLP-1.
I don't believe so. He's not taking the GLP-1s.
Well, if you've done it without any help, that's congratulations to you. It's really hard to do. It's hard to keep it off as well.
It seems he wants to join the Guard and doesn't want to cause any issues that would prevent him from signing, which makes sense.
One thing you could do is take Nature's Ozempic berberine, which is an over-the-counter product. Make sure you get the dihydroberberine and take it twice a day, 30 minutes before the 2 meals of the day.
But, so he's already taken berberine. That's what got him there.
Good.
Yeah, that's awesome.
Berberine. Yeah. But I'm not sure about the rules for the GLP-1s in the military. I don't know.
Yeah, that's interesting. I don't think there's anything with athletes. Although there was that article as it being like a performance enhancer.
It's a longevity drug for sure.
Yeah, it's interesting. Big Papa, let me know if that helps a little bit. We're going to go to a few more questions over here. I see people are chiming in. Thank you guys so much. Huge shout out to Shelly for bringing us Lori Lynn. Lori Lynn, thank you for being here. That's awesome. Thank you, Shelly. Let's go. Terry's been with us since Jack White. That's right.
Oh, wow.
I love it.
Terry, he's a good man.
Terry's the best.
Where are the peaches? Are you going to get some more peaches this summer? It's almost peach season.
I love it. I can't wait for peach season.
I love those South Carolina peaches.
Let's see where I'm at. Let's get to Karen and Shelly. Okay, let's get to Shelly's question. Any good advice for recurrent Epstein-Barr virus, supplements, medications, etc.?
Yeah, mono. Gosh, once you have the Epstein-Barr virus, it kind of can hang around forever, but it doesn't mean you have to feel tired forever. Certainly, COVID reactivated a lot of Epstein-Barr. Again, there's a lot of things to take into consideration here. Sometimes I like to use the ivermectin for it. I like methylene blue. I like LDN. I like Myers cocktails, the IV treatments. I like a good night's sleep. Some people, you need to look at your inflammatory markers and balance all that out. Make sure your gut's working right. Take Digestion for sure. That will help your gut in every way. And if your gut's working good, everything else is going to be working good. But and sometimes we'll follow titers, but it's can be misleading. And there's a lot of theories about Epstein-Barr. Is it something else that's really causing it, like chronic Lyme? And it's very controversial. Sometimes I will just kind of inherently shotgun and put somebody on a month's worth of doxycycline, see if it helps. Because besides Lyme, I mean, we probably only have identified about 3% of what a tick bite can do. The other stuff we just don't know. And that's why if you put them on doxy, it usually gets rid of tick-borne illnesses, which are common. But there's a lot of theories about Lyme and where it came from, and but those are some things I would try. You need to kind of go outside the box, because nobody's going to really take you seriously if you go to most doctors. They're just going to blow it off, as you know. I'm sure you've been there. So you got to look outside the box. I love the LDN. I love the methylene blue, which has a lot of antiviral properties in itself.
Shelly, thank you so much for that question. It's interesting, super interesting around the Epstein-Barr, and then you mentioned chronic Lyme. I want to get to Ruel here. Please, I apologize if I'm mispronouncing your name, but I'm going to say thank you, man. Thank you for being here. Thank you so much for being with us tonight. And the question is, can performance medicine work with remote out-of-state patients online, specifically Colorado and New Mexico? I really appreciate this question. We're actually working on this as we speak, Rel. And so as of right now, we'd say no to those states, but we're working on it. So thank you for actually giving us the states that you're in. And
I think that's the one. Colorado may be in that coalition.
Yeah.
We're working really hard to do this again. When for the 4 years that COVID was going on, we did, because it was legal for us to do so. And then they cut that out this past year.
Yeah.
So we were treating a lot of people from all over the country. And then they came up with this stupid rule that you can't. But there's a movement to not have to have a full license in every state to be able to practice there. And even though, it's technically up to the state boards as to who practices there, a lot of times we run into problems because the pharmacy may not fill the prescription that we may want to use, or especially if it's hormonal. But yeah, stay tuned.
Yeah, stay tuned.
And certainly, if you're in Colorado, New Mexico, certainly look for an integrated functional medicine doctor that's board certified in functional medicine, and they'll know all about all this stuff.
And also, please, this is one of the reasons we do this show, is for people who might not, be close to a performance medicine. We try to do as much as we can just by educating on the show. So thank you so much for being here, and just keep coming to the show. We're gonna roll some stuff out as we learn more and more about what we can and cannot do. But we're working on this. So thank you for that comment there. I want to get to Karen here. Thank you, Karen, for being patient with me. Please repeat lipid panel test, fatty acid level, calcium score.
Yeah, those are things that you want to look at to take a deeper dive on whether or not you should be on a statin or not. Is the Cleveland panel, which shows fatty acid levels and particle size, LP little a, etc., on your lipid analysis. It kind of reminds me of a Berkeley heart score or a Boston heart score. Calcium score is a CAT scan, of course, of your heart. A lot of times we'll take that into consideration, although it's not a perfect test either. It can have its little nuances, kind of like a PSA can. But we look at everything together, and I'm telling you that Cleveland heart panel is the best thing we do. It really is. And I would tell most people to get on a baby aspirin, not a statin, unless they have a lot of plaque. And, I'm really worried about them if they're diabetic, hypertensive. So you got to look at this whole thing together. But I don't just slap everybody on a statin like most doctors do. Matter of fact, most doctors, in a roundabout way, feel like they have to, because they get penalized if they don't.
Super interesting. Karen, thank you so much. I hope that helps a little bit. I'm going to go to Instagram real quick for Megan Inspirations. Megan, thank you for being here. Any recommendations on starting berberine to help with cholesterol, doses, etc.? I worry about low blood sugars. That's a great question. And thank you for pointing out being worried about low blood sugar with berberine. What's your thoughts on this one for Megan?
Yeah, certainly, berberine is good for metabolic syndrome, which includes insulin resistance, hypertension, and prediabetes. So the dose, I like the dihydroberberine, 200 milligram twice a day, 30 minutes before the 2 meals you're going to eat. You don't need 3 meals, you need 2, because you're going to do intermittent fasting. But if you're already, I don't worry about hypoglycemia unless you're already on a diabetic drug, and then you may have to lower it and watch out for the hypoglycemia. One thing I like to do, which I've demonstrated on this show, and raising 2 diabetic kids, I know all about it, is wearing a continuous glucose monitor. That way you'll kind of know if you're getting low. It'll beep, and you know what it does in the middle of the night. So wear one of those if you're worried about it. Get a Stello. You can get them over the counter now. We have them in all our offices. We'll put them on for you, tune them into your phone. If you want to, you can do it on your own through Amazon. But get a continuous glucose monitor, and certainly that's the way I would dose it. And I think it's beneficial for all the parameters of metabolic syndrome. And it's safe. It's very safe. I've only seen it cause a couple side effects. One of them, it could cause a little GI upset in some people.
Megan, does that help a little bit? Thank you so much for that berberine question. Great question there. Cool. Thank you so much. You're the best. Thank you so much. Let's get to Roel here. I got Roel and Ruel. I love you guys. Thank y'all for being with us.
Hope we don't get them mixed up.
I won't. I will never get that mixed up. Roel and Ruel. Roel is asking, been on tadalafil for about 3 months with 5 milligrams daily, but I took a 3-day break because I feel like I can feel the blood flow in my left arm bicep vein down to my thumb. Any thoughts? Only on left arm.
That is really strange. So are you saying when you take it, you feel that? Or when you got off of it? Because I feel okay. Okay, it sounds like to me. So when you were on it, you felt like you could feel the blood flow. You know, it is a nitric oxide agonist, so it should improve blood flow. I don't know why it would improve it on one side. Although your circulation to the left side of your body is a little different from where your subclavian vein comes off. So I suppose it could, you know, I put people with Raynaud's on tadalafil all the time, even women who get Raynaud's more, it seems like, to improve blood flow to their hands and feet. It really does help. Yeah, you would just wonder if you have some kind of weird condition like a thoracic outlet syndrome or subclavian steel. Make sure your blood pressures are the same in both. Take your blood pressure in the right and left arm and see what that does. You know, and there's some crude tests to look at for venous flow. Again, blood pressure is arterial flow. You know, if one hand tends to stay colder or more white than the other one, you may have a little discrepancy in the way your blood's circulating around. That's really interesting. So when you got off of it, if it went away, try it again and see if it comes back. And then you'll know, hey, that tadalafil's doing something with my circulation.
That's actually something you say quite a bit. Like especially if you notice you just start something and then you have a symptom.
It could be something entirely different, not related. And that's not going to be a serious side effect anyway. I've had a few people get low back pain from taking tadalafil, but that's rare too. And that's usually if they have a compromised spine anyway.
Roel, does that help any? I hope that helps just a bit there. And keep us posted. Keep us posted next week with how that's going.
Yeah, I'd like to see that one.
Real quick, we're going to get just to a couple more questions. I'm going to see who I've missed, and then we're going to. Shelly's looking for a dose of methylene blue. How would you dose that?
I would, if you start out with the drops, I would do 8 drops in the morning for a week, then pop it up to 12 to 16 drops. That's still a very low dose, and going up to 32 if you need it. See how you feel. Go slow. If you take the Neuroprotect Plus, which is the pill form, which has vitamin C in it. Remember, take vitamin C when you take methylene blue. It just makes it work better, be absorbed better. But if you take the Neuroprotect Plus, which has 16 milligram, just cut it in half and take half of it for the first week and then go to the whole tablet. You take the whole tablet or 2, don't you?
I take 2 whole tablets. Yeah. Let's see here. Does that help Shelly? And then real quick, let's get to Dave. Thank you, brother, for being here. Hey, Team Rogers. Hey, Team Dave.
Hey, Dave.
Any treatments for rheumatoid arthritis, DMSO, which that's the topic we need to talk about.
DMSO is so complex. I'm kind of waiting for the final word from the Midwestern doctor about that. If you ever want to hear a good blog about DMSO, just Google a Midwestern doctor.
Yeah.
He's a really smart, interesting guy. He loves DMSO. It's possible. You know, again, I like LDN. I use that on all my autoimmune patients. Had one today with RA, and she was on, what was she on? Rinvoq, which is a new type of treatment, and she didn't like the side effects much, but it is helping her RA. She's been on everything else, Plaquenil, Humira, all that. But yeah, DMSO holds a lot of promise. It's just, for me, it's been hard to kind of find the sources and the dosing. So I'm really, at some point, I'm going to do a full podcast or 2 or 3 maybe, because it's a broad subject as to what else, all that can help. But it's a really underutilized drug. It got a bad name, I think, because years ago, somebody not overdosed on DMSO. It's very safe, but what DMSO, when you usually think of it, you think of using the cream, and that helps things be absorbed through the skin. It'll just bring about anything in. So a migrant worker was picking some kind of crop in a field, and he was really sore from, picking soybeans or whatever he was picking, fruit. So he lathered his body up with DMSO all over, because it works. But he wandered into the field, and the field was full of something like Roundup, and he got toxic. Because you went straight in. It killed him.
Jeez.
So you got to be careful with that. But, I mean, that's something that is very rare, and you don't want that happen. But I think it got a bad name because of that episode. But go to a Midwestern doctor, Dave, and we're going to certainly start looking at it really closely. I think it's an amazing product for many, many things, not just sore joints.
Dave, thank you for that question. Guys, we are going to call it an evening. We gotta get running, but I see I've missed a few. So what I'm going to do is I'm going to make sure I'm going to write down these topics that I missed, and we'll get those on the first part of the episode next week, first part of the live Q&A. So if I missed you, please come back Tuesday. We do this 7 to 8 every single week. Thank you in advance to everybody who keeps hanging out with us. Is it not cool that everybody hangs out with us every week?
It's really cool.
This is cool. And I see Megan. I'm going to get to that one as well.
Do you see that Avicen machine in the back? I just happened to notice that. Dave, That's one thing that we use for arthritis. You put your hand in that machine.
It's on my...
Look up the Avicen machine. That thing's pretty cool.
Yeah.
For arthritis, especially in the hands, but it helps your whole body. So we do like the Avicen machine.
All right, guys, thank y'all for being patient with me. We will get to the questions I missed. I'm writing them down. Megan, I got you. And we're going to be back next week, 7 to 8, answering your questions. Connie's asking for the dogs. I want the dogs up here too. I have no clue where they are.
They may be outside.
They might be.
They're enjoying the summer being outside. Those. Can we flip a picture? We should flip a picture of them after they got into the methylene blue.
Let's see if we can
I don't know
find
if you have it or not.
our methylene blue dog pic, which is one of our more famous pictures. These are just of the dogs. Oh, there we go. The methylene blue dogs.
Yeah.
I love it.
They got into the methylene blue.
Yeah.
So going to our carpets, our rugs, and our hardwood floor. It's still there.
I love it. I love it. Connie Lynn, thank you for that. Thank you, Dave. Thank you, Carter. I love you. How is Jenny's hands? Jenny's hands okay? What was wrong? The thing. I actually have it right here.
What are you talking about?
Mark was asking about Mom's hands.
Oh yeah. It's too early to tell. We're working on it. She I can't get her to even think about using it. So Mark, I'm not even sure if how much she's used it, if at all, maybe one time, but if she doesn't start using it, I'm going to start using it on my knee. I've tweaked my knee playing pickleball Sunday. I was out there for 2.5 hours. I already had a sore knee.
He's hobbling around.
So I was hobbling around a little bit. So I'll use it on me and see how it works. I'll start tonight, Mark.
Mark, thank you so much.
He goes to extreme lengths to help. He even printed out this Virginia step by step how to do it.
He's the best. Natisha, thank you. Guys, let us know how we did. Kari, the side by side is working. We
Is it?
love this setup. We get to hang out on a Tuesday
Easier.
evening together.
It's easier. Yeah.
It's super cool. You need to go do your thing, guys. Thank
right.
you. Thank you so much, Megan Inspirations. I got your question written down. I'm gonna after we end the show, I'm gonna take notes of the stuff I missed, and we will get to that next week. 7 to 8 guys next week. I hope to see every one of you guys there. Steve, thank you so much. I love you. Thank you, D-Lynn. We're gonna Carter, thank you so much for being here. So good to see you today. And I'm so sorry. I totally dropped the ball on the note. So sorry. All right, we're gonna call it a show. Thank you, Tom. Thank you, Roel. You guys are the best. All right, where's my outro at? Let's see.
You never can find.
I can't find my outro. There we go. See you guys.
Don't go away.
Oh, we're still live.
We're still on.
Hey guys, I missed the outro. All right, now we'll be back next week.